and welcome into To Your Health. And heaven knows we have got a lot of health needs. And we have with us today someone who is with Baptist, with our system of Baptist, and we are trying to help everything that we see as a desperate need, one of them being ERs. And we are so proud of something that is happening right here in Montgomery, Alabama. That's the opening of a brand new portion of the ER department at Baptist South.
That's right.
Peter, it's so exciting. And we agreed, folks, for your sake, we're going to just take a little deviation here. So many people are coming down with either the flu or this or that or something that's not the flu, but this devastating cough that's hanging on. Right. Should you just immediately go to the emergency room? What is the best path for care for that?
Well, first of all, Miss Virginia, thank y'all for having me.
Oh, we love it. We love it. We're so
always
excited.
Love to come on the show.
We're excited.
And yeah, well, thank you. And we'll certainly talk about the exciting project of the expansion of the emergency department of Baptist Medical Center South. But I know this time of year, a lot of folks are feeling ill, or their loved ones, family members, children, grandchildren are kind of coming down with different things. And there are a lot of respiratory illnesses that are floating out there. And flu is running rampant. Alabama is one of the highest states in terms of flu and contracting the flu. And COVID is still out there. It is definitely still out there. We're continuing to see in all three Baptist Health emergency departments, so Baptist Medical Center South, Baptist Medical Center East, and Prattville Baptist Hospital, and really throughout the state, we're seeing a variety of flu, COVID, RSV, which is another respiratory virus. It's predominantly in pediatric population, but we're seeing a lot of those things. And certainly if your loved one, your child, your grandparent, your neighbor, if they're truly in some type of respiratory distress, I would strongly encourage you to get not only to an emergency department, but the nearest, the closest emergency department for care. But if it does appear to be in fairly easily diagnosable as low risk type of cold, flu, or COVID, and the symptoms are reasonably mild, we strongly encourage people to take another level of care, maybe your primary care physician. And if you don't have a primary care physician, I strongly encourage to try to build that relationship. And I know it's not easy sometimes to find a primary care physician or a doctor who's taking new patients. But that is the best and safest place to get that care. Because that primary care physician, you build a relationship with him or her. They know you, they know your medical history, they know what your drug allergies, all those kinds of things. So we strongly encourage primary care physician. And if you don't have a primary care physician, there is a plethora of networks of urgent care centers throughout the river region they'll take walk-ins. You really don't even have to have an appointment, and they take most insurance plans, and they can adequately address a lot of those ailments.
We're talking about the conditions of ER. We're overloaded, you're right. If you've been to one, you know you can be there for hours. It's just, and it's nobody's fault. It's just, we just don't have enough. The system is under pressure.
It is.
So Baptist made the decision, and I'm so proud. Tell me why you did it and what you've done.
Right. So the impetus behind the ED expansion at Baptist Medical Center South was the overcrowding that we were experiencing. And there's a lot of dynamics going on in the Montgomery market that have contributed to that. But what we were seeing, frankly, is waiting rooms that were full. Right. We have metrics in terms of when someone presents at the ER, we expect them to be at least triaged within a certain number of minutes. And after they're triaged and you figure out, well, gosh, this is true emergency or not true emergency, then we want to start diagnostic testing, right? We get a sample and bring it to the lab and see what's going on. We may run some diagnostic imaging, so CT scan, MRI, ultrasound, those kinds of things. All those are great diagnostic tools. And we want to be able to do those things within a certain amount of time. Right. Timeliness is very important. So when we're not hitting those metrics, that's a great indicator to us that we need to expand our resources. And the second big lever that we looked at is when a disposition is made. So if a patient comes in, we run all those tests and we determine that that patient meets criteria to be admitted, like you're going to not just be treated and released, but be admitted and stay overnight. Well, we want to get them to the safest place as quickly as possible. And what we were finding is it was no room at the end, and this is not unique to Baptist South. This is happening at hospitals all over. And so patients were waiting not for hours in the ER, but sometimes days, and sometimes in a stretcher in the hallway. And that's not the kind of patient experience that we want for those who choose us. So this expansion will certainly help that.
Well, you certainly had enough impediments to do this, and we're going to be back with you next week, and we're going to let you know what we actually wound up with and how fantastic it is.
I look forward to it.
Thank you so much for being with us, and y'all stay with us. We've got a lot to share with you, and we'll be right back.